I've been a Macmillan nurse for 15 years at this trust, and during that time the number of cancers has increased year on year. We know that more people are living longer with cancer now, and so we're needing to support more patients who not only have cancer but are living with the cancer.
If we look at Tameside and Glossop, we have some of the poorest outcomes with respect to improving outcomes for cancer patients. We have many more patients dying prematurely than the national average. We don't have any dedicated facilities for cancer patients. Patients who require chemotherapy have to attend Christie's Hospital.
A lot of our patients have to rely on public transport. You know, when you're going through something like chemotherapy, a very gruelling and unpleasant treatment, then the last thing you want to do is be stood at bus stops, etc.
To go to Christie for his chemotherapy, my dad had to use patient transport, which was a really stressful experience for him and really difficult. A 10 o'clock in the morning appointment, he had to be ready by 7 a.m, didn't he?
But they might not pick him up till 9, so he could miss his 10 o'clock appointment.
And then after his treatment, waiting for patient transport, it could be it was 7 o'clock at night that he got home one night.
I've relied on friends and family to take me there. I believe there's a minibus service, like a voluntary service, but when I rang them up, they said there was a 3-month waiting list, so that was no longer an option.
By having to wait for the patient transport, it made it very distressing for him.
And us.
And us, yeah, and us.
You have got enough to deal with operations, chemotherapy. Obviously, it's a massive worry without having other things to worry about, like, oh, how am I going to get to my appointments? Because it's my treatment, it's my chemo treatment, and it's vital.
We have had some patients who've really had to think twice about agreeing to treatment because one of the things they were concerned about was the travelling and having to go to a different hospital.
Well, from a patient perspective, it's very fragmented because they're seeing different people all the time, and it's difficult for staff because they can't provide the right environment for those patients.
The working conditions at the moment do have their difficulties. Because most of the patients are going off to other hospitals for the treatment, we do lose contact with them. If more people could have the treatment here, that would be much better, both for patients and for nurses. We'd be able to see them more frequently.
When I was given my diagnosis, it was actually in a small, rather unpleasant, very austere examination room. There were 4 people in the examination room, which made it very crowded. I exited straight into a sea of faces in a waiting room. When you open the door, people look round to see who's coming through the door. We made our way through the room, through the waiting room and out, and we just sat in the car for quite some time because we couldn't bring ourselves to drive home.
This new facility for Tameside and Glossop is so important. This will allow us to integrate services, so patients will be able to receive their treatment within this hospital rather than having to travel elsewhere. We'll be able to provide outpatient clinics. We're also looking at providing a central information and support department, so it will be a fantastic environment.
In the new building, I believe there's going to be a private consultation area, which will make the world of difference after being given your diagnosis, because for a lot of people, you're extremely upset. You need somewhere to go just for that little bit of quiet time, or to talk, or just to take in what you've been told.
One thing that has evolved from the development of the Tameside Macmillan unit is a user group. We've actually been involved with an art consultant, and the idea of that was to develop not just a colour scheme, but the atmosphere, the ambience, the feeling, and I think that's very, very important.
I think the new centre is going to be fantastic. They're familiar with it, they know where to come, they know where to park. That always makes it easier for them. I think they'll be looked after by staff that they already know, who they have a relationship with, a rapport with, and who they trust.
I think the single best advantage of this new centre is that it is almost a one-stop shop, that people can come, have their diagnosis, have their treatment in one place, in a hospital they're familiar with, and the surroundings will be pleasant.
What a wonderful opportunity, because for so many of those people now, rather than having those really rotten journeys, they're going to have the ease of an easily accessible journey, plus they're going to be treated and have their support needs met by the team that they're familiar with. Plus, we're going to expand our complementary therapies, have that fantastic specialist information and support area. I think it's going to be fantastic.
A single centre would just make it easy to help your relative instead of not knowing, you're stressed and you don't know how to help them, and this would make it easy to help them.
One place where you could go for everything, and you can sit down then and either help them get better, spend your last few days with them, rather than worry where you're going next, who do you need to speak to get the best care.
We can't do this on our own.
We need your support.
Please help us to raise
£2 million
To build the new Tameside Macmillan unit. Got it right.